Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. In today's podcast episode, I will be talking to you about the different types of tests, medical tests or medical assessments that you should be getting done. All right, so please discuss this with your primary care providers and you should be getting these tests done. Okay, the first one that I have is the vision test. A vision test is just to check to make sure that your vision is good. If you do need glasses, you would know. All right, they check your vision and they check everything about your eyes. All right, this is different from a specific test that they do for people that have diabetes. We do have the diabetic eye examination, which is more specific to people that have diabetes because they want to check to make sure that they do not have diabetes in the eye, which is diabetic retinopathy. So this is a vision test that is done every 1 to 2 years. You should go for a vision check, and also you should be able to know if you do need glasses. If you're having problems with your eyes, they will be able to send you to an ophthalmologist or optometrist for evaluation and treatment. So vision test is very important as an adult to go. All right, okay. And then we have the diabetic eye examination. Just like I mentioned, people that have diabetes are expected to see their eye specialist once a year, at least once a year. But of course, if you do have problems with your eyes, if you have retinopathy, if you have glaucoma, if you have cataract, if you have macular degeneration, you may have to see your eye specialist more frequently. All right, so please just follow the recommendations of your primary care provider or your specialist in regards to the times and the frequency of your visits. Okay. All right, so we do have hearing tests as well. Hearing test is very important, especially for our adults that are older patients. So we do say that you lose some of your hearing as you get older. Some people have hearing loss, partial hearing loss. They cannot hear very well. They hear, certain types of noises and all that. Some people have tinnitus, which is ringing in the ears, and they will be referred to see a hearing specialist, which is an ENT specialist, to just make sure that everything is good. And some people, they have significant hearing loss, and they do need hearing aids. So when you go for your hearing test, you will be able to they will be able to evaluate you and make sure that if you do need hearing aids, that is prescribed for you and you're fitted for hearing aids. And if you do have any other issues going on with your ears, you'll be able to know at that time. So hearing test is very important as an adult. Okay. All right, we have bone density test. So bone density is another one that you should be getting as a female because as you get older, your bones get brittle. You're more prone to having fractures, falls and fractures. So you want to make sure that you're checked for osteopenia, osteoporosis. And so the bone density, you should be talking to your healthcare provider about when you should be getting that done, or if you should get that done. I know this is more common in women, but some men do end up having bone density tests as well. All right, so bone density is another test that you should talk to your primary care provider about. And then we have sleep study. A sleep study is required for some people that have problems sleeping. Either you snore a lot when you sleep, or you have interrupted sleep, or you feel like you wake up every so often because you stop breathing when you're sleeping, or people have told you that it seems like your oxygen or whatever is cut off when you're sleeping, and you have interrupted sleep, meaning that it feels like you're not breathing all through the night when you're sleeping, and you snore a lot, or you are very obese and it interferes with your breathing. So definitely you want to go for a sleep study to make sure that you do not have obstructive sleep apnea that may require you to have a device, like a CPAP machine that would help you with breathing at night. So if you're concerned that you have sleeping problems, or if your family, your friends are concerned that you do have sleeping problems, you might want to consider getting a sleep specialist to evaluate you and make sure that everything is good. Right, so a sleep study just involves you going into a center, and they will, you will sleep overnight at the center, and they will do some certain tests, and they will be able to tell you if you have sleep apnea or not. And then the recommendation will be given to you about what type of appliance is needed. All right, some people do need a CPAP machine, and some people just need like other kind of oral appliances. All right, so that's about sleep study. We're gonna go over to dental examination. So you want to take care of your teeth all the time. Dental examination is very important, even as children, even as adults. Technically, it's required that you go to your dentist about twice a year, every 6 months, if you do not have any problems, just for regular routine cleaning. But of course, as I mentioned before, for the eye exam, if you do have issues with your teeth or you have any dental problems, then the frequency of your visit may be more. All right, so but generally every 6 months for general cleaning. But if you do have gum disease, or if you do have oral problems, dental problems, then you may have to see your dentist every 3 months, or even more frequently every 4 months, like that. So talk to your healthcare provider about getting referred to a dentist, or see a dentist, and they'll be able to tell you how your teeth are, what you need to be done, and also when you're supposed to be coming in for your routine checkup. So dental examination, it's very, very important. And also some people do have different problems with their teeth. As I mentioned before, they may need a night guard if they grind their teeth at night. They may need a night guard. Some people have TMJ, and so they do need a guard to help them a lot. So all of this can be evaluated by your dentist. Okay, so we do have endodontists as well, and we do have special people that can take care of your teeth, or you can get referred. If you do need further evaluation, you can get referred to an endodontist or any kind of other specialist from a dentist if you do need that done. Okay, and then we have cognitive screening. This is very important. Cognition is very important. As you get older, a lot of our geriatric patients, they start having cognitive decline. So we do have the short-term memory, and we have the long-term memory. All right, so short-term memory is pretty much common that you lose some short-term memory as you get older, which is just due to age. Short-term memory meaning that something like, oh, where did I put my car keys? What did I eat last night? Oh, what is the name of that person? Okay, and then you lose that name for like a minute or two, but it comes back to you. And then we have long-term memory, like you can't remember anything about what you did as a child. You can't remember about what happened when you were younger. Some people start having problems with remembering names of their family members, and it's not coming back. Like they can't even recall the names of their siblings anymore. They can't recall the names of their children anymore, or their loved ones. And this breaks a lot of people's heart, when you see family members going through that. So definitely you want to be evaluated for dementia, Alzheimer's, and also you want to make sure that you're not having any cognitive decline. So cognitive screening is very important that you get that checked. So a primary care provider can do a cognitive screening for you, but if you do need more thorough checkup or referral, then they will refer you to a neurologist. Okay, if they see that maybe you have signs of dementia or Alzheimer's, you may be referred to a neurologist. So it's very important that you get your cognitive screening done. All right, and then we have spirometry. Spirometry is for people that have asthma or COPD. It's just a test that shows, tells you how well you're breathing, how well you are getting oxygen in, and how well you're doing in terms of your respiratory system. So if you do have asthma or COPD, you may want to talk to your healthcare provider or your pulmonologist about when you should be getting this test done, if anytime soon. Okay, so it's a spirometry test. All right, and then we have abdominal aortic ultrasound. Abdominal aortic ultrasound is also required for certain people. Talk to your healthcare provider about that abdominal aortic ultrasound. Okay. And then some other tests that you should be talking to your healthcare provider about are just like regular blood tests that would check your kidney function. Your kidney function will be checked, your EGFR, your serum creatinine levels, bilirubin levels, cholesterol levels, your lipid panel, hepatitis C screening, the different types of blood tests that you could get done just to check, and also the diabetes test as well, which is the A1C. That's the 3 months average, just checks to see how well you are doing. For diabetes, you want to make sure that want to make sure that you're not diabetic, and so they do that blood test for you. And also check your glucose levels. So A1C below 5.7 is no diabetes, and then 5.7 to 6.4 is pre-diabetes, and then anything over 6.4 is considered diabetes. So you want to get that A1C checked. All right, so good A1C. Talk to your healthcare primary care provider about getting your blood sugar test for diabetes. All right, and also we do have the urine test. So the urine test would check your kidneys, check how well your kidneys are working, and if you have sugar or glucose in your urine. So they will check for protein in your urine, they will check for sugar in your urine, and then you check for microalbumin as well. So yeah, definitely a urine test is done. Most times when you go in for your annual physical, they may collect a urine sample from you to check to see how your kidneys are working and if you have sugar or glucose in your urine. All right, so we do have that urine test. We have different types of blood tests, as I mentioned before. You check your kidneys, check your diabetes, and check your cholesterol levels, and also do a hepatitis C screening. So for your annual visit to your primary care provider, you want to follow up on your blood pressure. If you have blood pressure issues, you want to follow up with your diabetes. You want to follow up with your breathing, like I mentioned before. You want to follow up with your heart health. All right, and you also want to follow up with just generally any other thing that you're concerned or worried about, or if you have any questions about. All right, and then we have the screenings, other tests that should be done. They are Pap Smear. So we talked about Pap Smear before. Pap Smear is recommended for women 21 and older. So the ACOG says that 21 to 29 years old should have a Pap Smear every 3 years, Pap Smear alone every 3 years, and then 30 to 65, you should have a Pap Smear with the HPV testing, which is a co-testing. You should have that done every 5 years. All right, so if you're having a HPV test with your Pap Smear, it's every 5 years, but if you're having your Pap Smear alone, it's every 3 years. And then so you could decide to do HPV with your Pap Smear and go every 5 years, or if you want to do the Pap Smear by itself, then it's every 3 years. So talk to your healthcare primary care provider about this and see what should be done. Each person is different, so these are just guidelines. Some people, they have to have Pap Smear more frequently because maybe they had abnormal cells found before, or they do have a history of cancer, cervical cancer or whatever, so they may have to go more frequently for their Pap Smear or other kinds of tests. All right, so but that's just a regular guideline for Pap Smear every 3 years by itself, and if you're doing it with the HPV, every 5 years. And then we have breast cancer screening. So the breast cancer screening is the mammography, right? Mammogram. You have to get that done every 2 years. Some people do go every year. So talk to your healthcare provider about this as well. Talk to your primary care provider about this as well. Some people do every year, some people do every 2 years. I'll say between 1 and 2 years. And as I said, some people may have to go more frequently. Some people even do ultrasound after their mammogram just because they find abnormal tissue, and so they have to go for further testing. So talk to your primary care provider about your breast cancer screening, which is the mammogram. All right. And then we have colon cancer screening. Colon cancer screening, I had mentioned that before in my previous episode. Very important to get your colon checked. And so early detection saves lives, I always say. So please get your colon cancer screening. There are different ways that you could do that. You could do a colonoscopy, which is required every 10 years. But of course, if they find polyps, or you do have a family history, a close family history of cancer, you may have to go more frequently, like every 5 years. And I've even seen some people go every 3 years. So colonoscopy is one of the tests for colon cancer screening. And then we have sigmoidoscopy. The difference is that the sigmoidoscopy only checks some parts of your colon and not the whole colon. So yeah, so the sigmoidoscopy is every 7 years. And then we have Cologuard, which is every 3 years. And also we do have the FOBT, which is every year. So the FOBT is the little kits that they send you take home in the comfort of your home. You do the test, then you mail it back to the lab, and they will be able to detect if you have any kind of problem. So that is colon cancer screening. The different tests that you can get done, and you should talk to your primary care provider about which one is suitable for you and what is the frequency of your own test. All right, they may send you to a GI specialist, gastroenterologist as well, just to be able to help you further with colon cancer screening. All right, and then we have low dose chest CT. Low dose chest CT is not just done on everybody, it's done on people that mostly have a history of smoking. So please talk to your healthcare provider if you do have any history of smoking and see if this is appropriate for you. Low dose chest CT. All right. Okay, so those are the screenings that you should have done. And we mentioned also before in previous episodes the importance of getting your vaccinations. I believe in vaccines, and I will always be proactive, pro-vaccine rather, and I always tell my patients to please get vaccinated if they can. All right, so flu shots is every year. Pneumonia vaccine, we have 2 of those. We have Prevnar 13 and we have Pneumovax and Pneumovax 23, and they're given when you're 65 years and older, and they are spaced out at least 12 months apart. You do not get both of them the same day. So 65 years and older, Prevnar 13 and Pneumovax 23, and then we have shingles. All right, the newest shingles vaccine is called Shingrix, and there are 2 doses of those as well, and you are to take it 2 to 6 months apart from each other. All right, you go and get the first dose, and you go back 2 to 6 months later to get your second dose of Shingrix. All right, and that's for 50 years and older. And then we have hepatitis B as well. Talk to your primary care provider if you do need an hepatitis B vaccine. They come in 3 series, all right? And then we have the tetanus, diphtheria, and the pertussis, which is the whooping cough. So we call that a Tdap vaccine. It's recommended that you get a booster every 10 years. So talk to your primary care provider if you do need a Tdap vaccine or TD booster vaccine, and it's every 10 years for the booster, as I mentioned before. A lot of these screenings and vaccines may be covered by your healthcare insurance. Some of them are not covered 100%, and that is the reason why you should please consult with your insurance company to make sure that you get details about your co-payments and whatnot. All right, so these are the tests, and these are the screenings, and these are the things that you should be talking to your healthcare team about, your primary care provider about, or a specialist about. If you do have a cardiologist, check about your blood pressure, if you do, or your heart health. If you do have a GI doctor or specialist you want to talk about getting colon cancer screening or anything related to your GI. All right, an endocrinologist will be in charge of diabetes, thyroid problems, and things of that nature. And then a pulmonologist or sleep specialist will be in charge of breathing issues, asthma, COPD, bronchitis, things of that nature. So yeah, there are different specialists meant for different parts of your body, different organs, different systems, and your primary care provider is just a primary care provider. They can do a lot of these tests as well, but then if needed, they will refer you out to a specialist. So I hope this helps, and I hope that this gives you like a guide to what you should be talking to your health primary care provider about, your healthcare team about, and so that you are in good health and you stay in good health. All right. I hope this helps. Share with friends and family, and I will catch you in the next one. Remember, stay safe and be well. Bye bye.